Hi, I'm Jonathan, founder and designer at Brother Max. The following interview is between Rachel Liddell, health editor of Mother and Baby and Practical Parenting magazines, and Dr Hilary Jones, practicing GP and patron of Meningitis Research Foundation. They are discussing the diagnosis of meningitis in little ones and the importance of temperature taking.
Meningitis means there's an inflammation of the meninges, which are the covering membranes of the brain and spinal cord. And it's this inflammation which leads to the symptoms of meningitis. In an adult, the symptoms are often very classic. A very severe headache, a high fever, neck stiffness, a dislike of bright lights, nausea and vomiting. Those are the classic symptoms. There may be some of them, there will rarely be all of those symptoms. And if you're unlucky enough to develop the septicemic form of meningitis, where there's blood poisoning, you'll often see a dark red, purpley rash in the skin, which doesn't blanch if you press a glass tumbler against it. And if you see that sign, it's a very important sign to get yourself to hospital ASAP, because in that situation, minutes count. In babies and toddlers, the symptoms may be more subtle. What you're looking for in a baby is a baby who is off feeds, who is maybe vomiting, whose soft spot on the top of the head is bulging or feeling tense, a baby whose skin has become blotchy, whose cry has become shrill and high-pitched, a baby that you don't recognise as connecting with you as a mother or a father. Perhaps they're staring into space, perhaps they're drowsy, and their conscious level is falling. I think if you see any of those signs and confirm that there's a temperature as well, those are important signs not to ignore. And it's a sign to get further advice immediately and possibly to be even more proactive and take your baby to hospital straight away. These days we have some very good vaccines for meningitis, but we can't vaccinate against all forms of meningitis. We've got a very successful vaccine in HIV and also a vaccine that protects against meningococcal meningitis type C. And we give these as part of the routine immunisation programme. But we haven't yet cracked a vaccine for meningococcal type B, and that's the one that we see most disability and death from currently. So whilst we don't have vaccines to cover every type of meningitis and prevent it, it's important that parents remain vigilant and continue to look for the signs and symptoms. And if they want to learn what they are, by contacting the Meningitis Research Foundation, who can send out information sheets, cards to carry in purses or wallets, or stick to the front of your fridge at home so you never miss those early warning signs, which is so important not to miss. In the early stages, there's very little to tell between meningitis and flu. If you think about it, a sufferer of either of those conditions will feel a malaise, fatigue, lassitude, be off colour, perhaps be off their food. They may be nauseous or even vomit. They'll certainly have a headache. And it's as the disease progresses that the classic symptoms evolve. So neck stiffness, for example, is going to evolve with meningitis, and dislike of bright lights is a classic, typical feature of meningitis. Whereas with flu, it becomes more of a respiratory condition with sore throat, dry cough, and perhaps breathlessness. So in the early stages, they're very similar, which is why many parents mistake the diagnosis and why sometimes in the early stages doctors do as well. Meningitis is an illness which progresses terrifyingly fast sometimes. It's not at all unheard of for a baby or a toddler or an adult to be right as rain at 8 o'clock in the morning and extremely ill by the evening. So minutes count. The symptoms as they progress should be carefully monitored, and if someone even suspects that it might be meningitis, they need to get help very quickly indeed. Normal body temperature has a range somewhere between 36 and 37. A lot of people will say normal body temperature is 37.4, but in fact it will vary at different times of the day, and certainly it varies in age groups, so that a baby's temperature is slightly higher than that of a toddler, and again an adult's temperature will change as well. And it largely depends on the ambient temperature of the room in which somebody is in. It depends on what they're doing, whether they've been running about and very active, depends on what they're wearing, depends on whether they've had a meal. So the best way to find out what's the normal range for yourself or your children is to measure their temperature several times at different times of the day over several days, so that you get an idea of what's normal for them. And then when they're ill, you're not only confident about taking their temperature when it's a crisis, but you'll know what to compare the temperature to, compare it to normal, and interpret it correctly. The temperature will change depending on where you're measuring it from. So it'll be different on the forehead, for example, to in the armpit, to if you take the temperature through the oral route, or if you take an ear temperature. And the reason for that is there are so many variables if you take skin temperature. Even if you take an oral temperature reading, if the mouth isn't completely closed and if you haven't left the thermometer in there for a minute or so, you might get a reading which is lower than the core temperature. The most accurate readings are from the eardrum using an ear thermometer, or a rectal thermometer, which tends to be done mainly in hospitals. And in the same age group you'll get different readings, not vastly different within the normal range, but within 0.2 or 3 of a degree Celsius. So it's important to realise that small differences are not that important, they're quite normal. If we look on the chart here, you can see what the ranges are in different age groups, and there will be a variation between children of the same age group. So as long as you're aware of that, then it helps you to interpret what is normal and what is abnormal. I think a really good method of becoming truly confident when you're taking somebody's temperature is to become familiar with a good, reliable thermometer which you keep in the home, and test people when they're well, so that you take readings, say 3 times a day at different times of the day for several days, so you can assess and be confident about what's normal for them. Then, when a crisis happens and somebody's burning up with a fever, you can see exactly what to do and how the result compares to what's normal for that person. And then I think you can confidently say when you call the doctor or speak to the pharmacist, my child, my toddler, my brother, sister, whoever it is, has a temperature of this amount, which is completely different to what it normally is. When a temperature is elevated above the normal range for that person, it's important to assess that temperature in the context of how they look and what other signs and symptoms they're exhibiting. So if a child is running around, eating normally, playing, happy, smiling, engaging with you visually, and there's a slight temperature, it's probably nothing to worry about too much. But if they're very floppy, if they're off food, if they're exhibiting signs of a rash, or they're just not engaging with you, then the temperature is much more significant. If a temperature reaches, say, 39 degrees, 40 degrees, and there are signs and symptoms which suggest the child is ill and suffering, then clearly that's the time to get professional help and talk to somebody who can help you and guide you.